It's really a pleasure to be spending this time with you, and I'm really looking forward to answering your questions along with Sam later today, so don't be shy. Before I carry on, can I check? Tell me, can you see my slides? Does it all look okay? Yeah, I see nods. Brilliant. Okay, so today I'm going to give a very brief introduction to ICAM. I'm going to describe some of the indicators we might want to measure in our dog and cat population management work. I'll give a brief intro to Talea, which is a survey app provided by ICAM for free. And I'd also like to share some examples of how others have used data to show the impact of their work. Hopefully, I'm going to inspire you to try the same, but also to innovate further. Okay, let me start with this very quick introduction to ICAM. So we were first formed in 2006. Our members are all international charities or international specialist groups. You'll see their logos at the top of the slide, including Battersea. And our mission is to support the development of humane and effective dog and cat population management globally. We publish joint guidance documents. Here is a selection of 3 of those. We run conferences and webinars. All of the video presentations from our 2024 conference in June are available on our website, so please do check them out. And we also host free online courses. So we have 3 at the moment. One is a course on how to be a mentor to a multi-stakeholder group that wants to plan and implement their own DPM program, including how to keep them working together as a cohesive group. And then we have 2 others that are on dog population management more broadly, one for implementers of DPM and one for policymakers. And finally, we also develop tools. And one example is Talea, which means count in Latin. And I'm going to talk about that a bit more later today. Now, the fact that you have joined Sam and I today means that you do have an interest in data. Thank you very much. But just a quick refresher on why we should bother to collect data, particularly on our impact, rather than spend our time on all the other activities on our already long to-do list. So firstly, your donors, whether they're private individuals or public entities, they're going to want to know that their money is making an impact. Secondly, you can inform the public of any impacts on them or their animals, as they are the target beneficiaries of your intervention. Thirdly, you may want to use the evidence formed through impact assessment to lobby for sustaining, expanding, or replicating an intervention. And for those with an interest in a number of locations, so for example, national governments or international organisations, they may want to compare interventions and their relative effectiveness. But I think the most important is that data and impact assessment allows us to understand and assess our own interventions, and in turn learn from this and improve our impact. So what data might we collect? We tend to naturally collect data related to our effort, not least because this tends to have a clear cost attached to it. So the number of animals we treat, sterilise or vaccinate, the number that we rehome, the number of children we reach through our education campaigns, and if we're running, for example, an online behaviour campaign or advocacy programme, we may look at metrics like engagement with our social media posts. But actually, where we really need data is at the level of impact. These are the changes we actually want to make with all our hard work. So what you see on the slide here is a list of 8 commonly stated impacts that we identified and explored in our ICAM guidance document called Are We Making a Difference? And you'll find that on our website. And we provide quite a lot of guidance in there on how to measure all 8 of these, but I'm going to focus on just a few examples for today. And the key to measuring impact is all about the indicators that you choose. You need to select indicators that are measurable and meaningful representations of your impact. So the ripeness of a banana is indicated by its colour, even its smell. We don't hunt out yellow bananas because we like eating yellow things. It's because the colour of the banana tells us if the banana is ripe. So the ripeness is the change we care about. The colour is the indicator. So the first step in our data journey is establishing what impacts your intervention is aiming to have. Now, you might also call these changes or goals or aims. Pick any term you prefer. They're often quite broad statements, like we aim to improve dog welfare. The job of indicators, also known as metrics or key performance indicators, is to make these impacts measurable. So here's an example of an indicator for each of these 4 example impacts from that starting list of 8. Now, ideally, you want 2 or 3 indicators for each impact so that you're not relying on just one. And then you can do what's called triangulation. That is looking at more than one piece of evidence for the same impact. That's an ideal, not essential. And key to selecting these indicators is to have a method of measuring those indicators that is robust and repeatable. So by definition, it needs to be simple and affordable because you'll need to keep repeating it. So here are some examples of methods of measurement. We have a street survey coming up for the first 2. And I'm going to talk about street surveys more in a moment. For the third, we see a method of measurement that relies on someone else. It's a secondary source of data because someone else, the hospital in this case, is doing the data collection. Our job is to establish regular access to that data. And that will probably require a direct contact with someone working within the hospital. The final method I mentioned here is probably the most time-consuming. It's a household questionnaire. Now, I'm a big fan of street surveys because they can be really affordable and they provide data for several indicators. Now, I think people are sometimes nervous of street surveys because when they are used to calculate an estimate of the total dog or cat population size, there are complexities. You need to be careful how you set up your sample and careful with your subsequent analysis. And there are several options for analysis, so you need a little bit of experience for that one. But there is a simple option for street surveys that's still very powerful. So you can establish a convenient route that traverses those areas you know are hotspots for dogs and cats, where you're most likely to find them, and where you'll be focusing your management efforts. And then you simply repeat a count along that route over time, ensuring you keep the protocol the same, starting at the same time of day, using the same mode of transport, avoiding days with unusual weather or events like a public holiday. Basically, you're trying to ensure that any change in the number of animals you count on your route is reflecting or indicating a change in the wider population of those animals. So this is one of my favorite examples of street survey data used to measure an indicator of the change in free-roaming dog density over time. I like it because of its simplicity and also it shows long-term dedication to data collection. This is from an organisation called Helping Suffering in Jaipur in India, who run a classic ABC or CMVR intervention with a focus on sterilisation of female dogs and vaccination of all dogs. So they use 6 routes. They walk these every 6 or 12 months on 6 consecutive mornings. And you can see Dr. Sanjay in this photo with his clipboard. They're now using Talaya app to record their data instead. And what you see on the graph, the blue line is simply the total number of dogs seen on all of those 6 routes. And you can see there is a clear decline in that number over time, especially in the earlier years. And the bars show the percentage of females that were spayed, that were seen to be spayed because they had an ear notch. So this data set is now approaching 30 years. There's no complex analysis here, just the total number of dogs counted on each survey event and the percentage of females that had that ear notch showing that they were spayed. What makes this so powerful is the dedication to long-term data collection and the consistency. Same routes, same time of day, and same survey protocol year after year. And this is an example from a Soy Dog Foundation and Dogs Trust partnership in Bangkok. Because their working area is so large, they're working Greater Bangkok, 15 million people, they use 20 routes. Each one is surveyed from a motorbike over a period of 1 to 2 hours by 2 people. And the data on nearly all these 20 routes has shown a steady decrease over time in the number of dogs per kilometre seen on those streets surveyed. And when we combine the data from those 20 routes and look at the average dogs per kilometre street surveyed, we can see this has shown a very significant decline overall. So both these surveys are now using Talaya to implement and record their data. Now, I know there are other apps available, and if you've come across a solution that's working for you, then that is great. Only consider swapping if one of the following characteristics provides you an added benefit. So, starting with the structure of Talea, it's comprised of Talea Web, which is the website portal where you, in your survey manager role, sets up surveys, invites observers, and sends them survey packages. Importantly, this is also where you can see and download the data that's been collected. And then Talea app. This is what your team of observers have on their phone, and they use it to navigate along their survey route or within their survey area, and also to record any animals that they see. An important characteristic of Talea is its flexibility. So templates are the questions and the choices you will present to your observers when they're out in the street and they see an animal they want to record. There's a library of templates you can use. You can amend these or you can create your own from scratch. So although the library of templates are designed with dog and cat surveys in mind, you can use Talea for any animal. In fact, any sighting. You could even take Talea out in the street to count red cars if you like. The sandboxes are where your observers will do the survey, and you can give them routes to follow or present them with polygons or areas within which they will do all their surveying. So by default, sandboxes record the GPS location of the observer when the sighting is made. That's usually precise enough for dogs, but you can actually choose a sighting location option. And that requires the observer to tap on the map to show the precise location of the animal on the map when it's seen. This might be more relevant for cats, or if you're using distance sampling or analysis, an approach that is commonly used for wild mammals and birds. When it came to the app, our primary goal was to make it easy to use. So once you add an animal sighting, you answer questions about that animal, and the answers are represented with icons, not just text, and you select with a single tap, no drop downs. You can edit or delete any sighting, and the app provides you with navigation around the sandbox, showing you where you have been with a green track, which turns red if you stray too far from the sandbox. It also shows you the location of all the animals you've recorded. Importantly, Talea app can be used in any language. The survey manager is responsible for making sure the correct translations are included in the template in Talea Web. The main limitation with Talea app is that it's only available for Android devices. It doesn't work on iPhones yet. The iOS version is in development now. I'm not going to have time to explain the setup today, but please know there is a video user guide that you can follow, but perhaps the best introduction would come from our Talea webinar, which you can find on the ICAM website. So please take a look if you're thinking of starting up street surveys, which I hope you will. So on to another example of data now, this time data collected from the public. So evidence of a reduction in dog density from our street surveys can be really important for securing government support. But an additional step is exploring whether this change is meaningful for citizens, which can be even more influential for elected officials. So Soy Dog ran a household questionnaire last year where they approached a random sample of households. And they asked a range of questions, both about dog ownership practice and their perceptions and experience of free-roaming dogs. One question was, how does your experience with free-roaming dogs differ today as compared to 9 years ago, before the CMVR project started? Of those people living in areas that had benefited from CMVR, most of them perceive the problem with dogs to be fewer today, and this is a dose-dependent effect. So the more CMVR rounds the neighbourhood had received, the more likely the resident was to say the problems had diminished, whilst people living in areas that had not yet received CMVR were equally likely to say the problems were greater today, as they were to say there were fewer. Now, this can be quite a powerful indicator for a government stakeholder, but household questionnaires are relatively costly to implement, especially when we consider that ideally you do need to repeat this over time. If you are planning on implementing a questionnaire, I recommend Kobo Toolbox as a data collection tool. It's easy to use and has some great online instructions. One alternative to household questionnaires is to try and access data on complaints about dogs or cats to municipalities. One challenge is this data is not always recorded or accessible, or if it is, it may not be at the level of detail that you need. So, for example, some complaints about nuisance or dog bites, but other complaints might be about animal welfare or requests for management action. And those are clearly measuring importantly different perceptions of free-roaming animals. So my recommendation is to work with whoever is receiving the complaints to set up a robust system of data capture with clear categories of complaint type and where geographically are these complaints coming from. And do that as soon as possible, ideally before your project starts, so that you have a baseline. You can also use street surveys to track changes in free-roaming animal welfare by scoring every animal you see for their basic welfare. So I recommend keeping this simple. So going for a body condition score scale that has only 5 grades, from 1, emaciated, through to 5, obese, leading to an indicator that is the percentage of the population that is in poor body condition score 1, emaciated, or 2, thin. And scoring skin condition as just the presence or absence of a visible skin problem. Now, with these welfare scores, it really matters that you have good inter-observer reliability. That means all your observers score animals in the same way, and also good intra-observer reliability, which means that the same observer scores the same way over time. And to achieve that, you need to invest in observer training and refresher training. To help you achieve this for body condition scoring, ICAM has developed a body condition scoring training and quiz that you can access on our website, and you can test your observers. Although testing people with real animals seen on test or pilot surveys will also be a necessary part of their training. The last data point I want to talk about today is dog bites. And I think this can be really powerful because bites are obviously distressing for citizens, but also bite treatment costs money. So governments are interested if you can show you have decreased dog bites. So this again is data from Helping Suffering in Jaipur. The publication is cited on the slide. And we can see in this top graph a decline in dog bites over time. And that decline occurred despite an annual increase in the human population of nearly 5% per year. So you would have expected to see an increase in dog bites over time as the human population serviced by this hospital increased. Now, this decline in dog bites will be in part due to there being fewer dogs overall, and in part due to vaccination leading to fewer rabid dogs. But dogs bite for many reasons, and rabies is only a very small proportion of those. So they also looked at the seasonality of bites and found that the highest bite rates occur shortly after peak whelping season. So the proposed motivation for many of the bites was maternal defensive aggression. These were mothers protecting puppies from a perceived threat, or indeed the puppies themselves biting. And sterilisation directly takes away that motivation and therefore had reduced many of the bites. I've got one more example of this from Bosnia in Eastern Europe. So Dogs Trust Worldwide set up in Bosnia in 2012, and they ran a comprehensive DPM project. It included CMVR, education, rehoming through a foster system, training of municipalities, and a very effective veterinary training program and associated marketing campaign, which has created a sustained increase in owned dog sterilisation levels. There have been a number of impacts of this DPM project, but I wanted to show you this one in particular from Sarajevo, where we have a reduction in dog bites reported by the Emergency Medical Centre in blue. These are definitely not rabies related, as they have very few rabies cases in Bosnia now, but these are strongly correlated with a reduction in the estimated free-roaming dog population in the city, which you see in orange. One point I did want to make, both about this data set and the dog bites in Jaipur, is that the data comes from just one hospital. This doesn't measure all the dog bites in the city, and that is okay. This is a sample from a representative hospital. In the same way that we do not survey every street, our street survey uses a route that covers a sample of streets. So long as we believe that our sample is a fair representation of the wider project area, it's not biased in any way, then sampling is a reasonable approach to make our monitoring more affordable. So just some key takeaways to finish. We can use robust and repeated methods of measurement to provide data and indicators. Those indicators measure our progress on impact and can be used to evaluate whether our intervention is working and establish support for its continuation. I've described just 3 methods today. There are many others you can read about in our Are We Making a Difference guide. Street surveys, questionnaire data, or accessing complaint data, and accessing bite data. In order to decide where to put your measurement effort, I suggest taking time to understand what your government really cares about. Which impact would they be most influenced by if you could show evidence of its progress? Okay, right. Well, thank you for your time and attention. Please do take a look at the resources on our website, including the Today webinar. Really happy to answer any questions you have along with Sam later today. But I'm going to give you over to Sam now, and I'll join you again afterwards.